Namaskar. You're watching Dr. KK Med Talks Fridays with Dr. Anita Khan, non-stop show 1031st episode. Let's have the headlines of the day. According to recent global statistics, infertility affects around 1 in 6 adults during their lifetime. It has been seen that women with aging women have overactive bladders and sneezes and allergies that impact these daily problems of these women also impact fertility issues. A comprehensive Danish study has revealed that women with asthma face higher risk of requiring fertility treatments and experiencing miscarriages. A recent research found that patients with atopic dermatitis have an increased prevalence of infertility. Doctors in Delhi report an increase in endometriosis in women aged between 30 to 35 years, with around 40% of new cases being linked to exposure to pollution and bacterial endotoxins. Health experts highlight that constant exposure to air pollution damages germ cells, that is, the eggs in women, because they also cause hormonal imbalance, they reduce the ovarian reserve, and lead to subfertility or early menopause. Let's go to the topic of the day. Today, we will be talking about beyond sneezes, how allergies impact women's daily health and fertility. So, now let me introduce our special guest. Dr. Vijay Varad is a highly regarded consultant allergist, pediatric pulmonologist, and clinical immunologist with a strong clinical and academic background. He specializes in the diagnosis and management of childhood allergies, asthma, respiratory disorders, and immune related conditions. Dr. Varad is associated with leading institutions including Sai Allergy Asthma Eye Hospital, Sahedri Hospital, and Inabdar Multi Speciality Hospital. With his patient focused approach and expertise in advanced therapies, he has been instrumental in improving outcomes for children with complex respiratory and immunological conditions. He is also an active contributor to awareness and education programs in the field of allergy and pulmonology. So, welcome, Dr. Saab. Welcome to our show today. Shall we start?
Yes, ma'am, please.
Okay.
Thank you, Dr.
So,
Anita, for the introduction.
welcome.
And thanks, IGCP, Med Talks, to give me an opportunity to share my more than 25 years experience in this field. Yes, please.
Today, I think most of us are going to learn a lot from your experience, and there'll be a lot of take home messages. So, what are allergies and how do they affect the overall health in women?
See, basically, allergy is an abnormal response of the body to the usual natural substances we are always exposed, like dust mites, pollens, insect droppings, animal danders, pollutants specifically, the indoor and outdoor pollutants also, even the animal danders, molds, funguses, foods, even not only from the air, even whatever we consume, the normal foods also like nuts, lentils, or any vegetable fruits. So these are all like a natural substances we are always exposed, but sometimes for some people they behave as an allergens and they then cause the problem. So I always say, under the sky, anybody can have allergy to anything. Only thing, the person will have a allergy to that substance. So allergens are the natural substances, but those people with a genetic tendency have a reaction to those. That's why they are called allergens.
And how do they affect overall health in women, especially?
Actually, women specifically, from top to bottom, even from hair loss to dandruff to asthma, bronchitis, to skin allergies, to PCOD, obesity, infertility, leukorrhea, vaginitis, so many things like urinary tract infections and all. So in the body, the inflammation continues into the females, and then they have a different type of symptoms.
Right.
Yes, ma'am.
Are some allergies more common in women than men?
Yes, definitely. Specifically, as I mentioned, the scalp, like seborrheic dermatitis and all. From there to specifically in Indian scenario, a lot of women still are using firewoods in their houses in the slums and rural areas. So that's why a lot of asthma, COPD, they are very common into these patients. And still the dusting is going on. So the dust mites and pollens are into the air, so they are exposed to that more.
And can these allergy worsen over time if they are not treated?
Yes, ma'am. Actually, it's a progressive disease, and that concept in India is not there. So even 80 crores of the people are taking anti-allergics in India, but they don't know it is a progressive disease. It continues even in spite of sometimes one or the other symptom is controlled. Suppose a woman is having a sinusitis. Some of the times within 2 to 3 years, she overcomes the sinusitis. Or some of the women during the pregnancy, if she had a asthma or urticaria, they overcome that. But after that, it continues inside with a minimal persistent inflammation. The newer sensitivities go on developing. And then later on, these women will go into eczema or stomach problems, food allergies, drug allergies, or again severe asthma, sinusitis, or obstructive sleep apnea. So that way it continues.
So, how can these allergies affect the daily activities and quality of life?
Actually, because of the inflammation of allergy, the person becomes very irritable. And women, they are so much, they are, I mean, in Indian scenario, they are a manager of the family. They have to manage so many things. And in that, if she's having a sinusitis, headache, if she's having a throat problem, she's having a bronchitis, difficulty in breathing, or skin allergies like secondary fungal infection, eczema, she gets irritated. So then that irritation will be whole into the family. So these type of women, they will beat the children or they will scold the children or maybe husbands or that way. And then the whole family disturbance happens. So they don't know like what is the solution for that. So the proper allergy management can reduce these things and they can enjoy the quality of life and the family life also will be having a very good, definitely.
Yes, the quality of life of the other family members will also
Yes,
improve
yes,
if
yes,
she is taken care of, right? So,
yes,
can these allergies cause fatigue or affect sleep in women?
yes, yes, definitely. When the inflammation increases because of the allergy, the overall weakness, fatigue, easy exhaustion of the eyes. So that is very common actually. Yes, ma'am.
Yes. So, are there any specific triggers that women should be aware of at home or at
Yes,
workplace?
yes, actually, indoor pollution like firewoods, then agarbatti, then all these doop sticks, and these are very important as well as the specifically the mosquito repellents. Then whatever if that still you're using a firewoods or even the dusting, as I mentioned, dust mites will be to the airborne and the pollens and molds. So suppose there is some fungus in a house somewhere, there should be a 5% liquid ammonia to not to have spores. Into the kitchen food particles, we did a survey in Pune. And we found that a lot of the children and women, because they are in mostly kitchen, so the food particles into deep pockets, they have a lot of fungus spores. So there the vacuum cleaning should be done. So such type of practices will definitely reduce the trigger. And the smoke, like when they do the tadka and all this frying and all, that smoke is also a
Mhm.
trigger. So they should have a proper chimney or exhaust at that place so that that smoke also should not trigger them.
Mhm. Yes, you are right. Or can these allergies impact menstrual cycles or hormonal balance in a woman's life?
Yes, ma'am. Actually, there are a lot of studies done, and it has been found that during the menstruation cycle and the pregnancy or these things, the hormonal changes happen. And so, some of the patients, these will trigger the allergies. Specifically, even we have seen a significant atopic dermatitis during the menstrual cycle in the young women, as well as even if childbearing age or if they are having an active sexual life, those women also during the menstrual cycle or before or after that, they have inflammatory things, vaginitis or urinary tract infections, infertility, then PCOD. It has been found there are strong connections with the allergy inflammation basically.
Right. And do these allergies affect fertility in women also?
Yes, but there are studies done now, Th2 inflammation into the tubules, the fallopian tubes. It's very well known. And if the allergy is controlled, the inflammation reduces and they get immediately fertile. I have my around 25 to 27 women. They used to come me for asthma, rhinosinusitis. We treated, and 6 to 8 years they were not conceiving. Within 3 to 6 months, they got conceived. So then, when I talked
Oh,
to the Germany, Ulster University, I had been in 2019. So there they have done the studies. Even recently, when I had a lecture in one of the multiple talks, and my talk was there, and after that, one of the infertility experts' talk was there. So she said, yes, it has been documented now. The stage 2 inflammation is positive for the infertility also. So maybe because of the allergens as well as the pollutants, both way.
okay, okay.
Yes, ma'am.
So, like you are very clear that asthma or allergies can lead to infertility, but can they also increase the risk of miscarriage?
Yes, ma'am. Today only one of the very well-known advocate from Pune. Her first child is taking treatment from me last 2 years. But that time I only told her he like she is having changes under the eyes, melasma and throat and all. But she did not go for that. And when now she became pregnant, she started having a sinusitis, bronchitis. So then she came to me. But that it was time already late. We can't do the testing during that time. We can't
Mhm.
desensitize. So one fine day she had a viral infection and that triggered the bronchitis and she lost time in that baby. Today only she had
Oh,
been to me after 15 days of miscarriage. And she was literally crying, she like, sir, I would have listened you that time only, so I did not face this problem. So it's very well known actually. Yes.
yes. You are very right. And are women with allergies are more likely than other women to land up in IVF centers asking for treatment for infertility?
Yes, ma'am. There are studies done now, and it has been
Mhm.
found that definitely the more women with asthma, allergic inflammation, urticaria, eczema, and all, they are having a more percentage of infertility and all. They have to go to the all these things definitely.
So, how do allergy medications affect the pregnancy and fertility? Actually, people think the other way around. If they take treatment, that will adversely affect.
Actually, rather than that, as I mentioned, if you control the inflammation with the safe anti-inflammatory medications, even
Mhm.
hexaconazine, bilastine, or montelukast, and all, they are very safe. Even if they're having asthma, then the salmeterol fluticasone combinations or formoterol budesonide are safer. The inflammation, if it is controlled, it helps the patients to continue the pregnancy very well. No side effects, nothing, and they can have a good quality of life. And the miscarriages and abortions are also less, and the fertility also chances are much better. So it should be controlled with the proper allergy and clinical immunologist, and they can have a very good quality of pregnancy.
Right. Is
Yes,
it
ma'am.
safe to continue allergy medications during pregnancy?
Yes, ma'am. Even not only the, as I mentioned about the fexofenadine, bilastine or something, even the inhalers can also be continued. Even patients on biologics like omalizumab before the pregnancy, we have continued and we have very good results. Even immunotherapy also can be given. Because that is a disease modifying, that is that their
Mhm.
children also should not have more severe allergies. So they can be definitely continued. Definitely.
Right. Can untreated allergies during pregnancy harm the baby? You just gave us an example, but beside that, also any abnormality or anything like that?
Yes, ma'am. Actually, there are 30% of the women if they are not properly treated, after the pregnancy, they have more severe allergies like urticaria, eczema, asthma. It continues, or rhinosinusitis or ocular allergies. So it has to be managed properly. Other 30% of the women go into the severe allergies.
Right. And are there any preventive strategies for women with allergies who are planning to become pregnant?
Yes, ma'am. Actually, with a proper allergies experience, get a screening clinically, any changes of hidden signs, then do some specific and standardized allergy tests, what sensitization is happening. Then some simple precautions can be taken accordingly. Then the nasal wash and all can be continued. And some simple safe medications. They will definitely prevent the severe allergies.
You were talking about nasal wash. Certain
Yes, ma'am.
people feel that Ayurveda procedures, like they also have some jalneti and all that. Are they, if you know, combine
Yes,
it with
ma'am.
the allopathic
Yeah,
medicine, are they
yeah.
more helpful?
Yes, yes, ma'am. Actually, nasal wash means the improved version of Jalneti, basically. It is an
Mm-hmm.
improved version of
Mm-hmm.
Jalneti. So this should be
Mm-hmm.
continued, no harm.
Mm-hmm.
Actually, it has a more benefit only. And
Mm-hmm.
not only that, even every person in Pune or Delhi like cities should do daily also.
Okay. So that all the pollutants which are caught there, not yet entered, they should be
Yes,
washed away.
yes.
Right, right. So, how are allergies diagnosed beyond just the skin symptoms?
Yeah, actually, there are some tests like XL nitric oxide. Even during pregnancy also can be done. Then there are oscillometry tests are there. Then there are like skin moisturometers are there. Then rhinomanometry is there, non-invasive, no side effects. Then clinically also these hidden signs. Then serum specific Ig, total Ig. Then even eosinophil count. So these are biomarkers like interleukins, mast cell activation tests and all. They also can be done to diagnose the allergies.
So, when should a woman consult a, let's say, a immunologist or a allergy specialist in
See, as
layman
I
terms?
mentioned, if there are hidden signs like dark circles, long eyelashes, gaining organ
Mm-hmm.
folds like rubbing eyes and nose or something, and there is a
Mm-hmm.
significant seborrheic dermatitis, then significant hair loss, dandruff, or throat pains, sinusitis, or
Mm-hmm.
asthma, or eczema, fungal infection, like or gut inflammation. If it is not
Mm-hmm.
resolving within 2 to 3 days, 5 days, 7 days, it's always better
Mm-hmm.
because in an early stage we can treat it much better than the complications.
That's right, right, right.
Yes.
So, any lifestyle modifications that help manage these allergy symptoms
Yes,
effectively?
ma'am. Actually, the homemade foods, outside food should be stopped. Then the simple precautions like having a vacuum cleaning and all. Then doing a pranayama yoga, some good anti-inflammatory like curcumin, colostrum, or some medications are also there. They can also be consumed. And antioxidants, the zinc, vitamin D3, they are also having a very good role.
Right. So, what are the modern treatment options for women with allergies
See,
besides
standardized
medicines?
specific IG, safe specific IG skin allergy tests are the best one. Some of the patients, the component diagnosis blood allergy test. Then, depending on the things like safe hexofenadine, bilastine, like Montelukast, or if you asthma, then safe inhalers like modern medications. Then, some of the patients, the biologics before the pregnancy. But if during the consummate or something, these biologics also can be used to reduce the inflammation. And then add on these research-based antioxidants like quercetin is there, L-lysine and all. They also can be added on, and they can control the inflammation much better.
Right. So, can immunotherapy or allergy shots help with the fertility related allergy concerns?
Actually, before the fertility, they are useful. If they are taken, then the inflammation will be reduced. And once the patient becomes pregnant, during the pregnancy, still it has not been advocated. But if it is continued before the pregnancy, we can continue. So in infertility, it helps definitely.
So, are there any alternative therapies which are safe for women who are trying for pregnancy or who have actually conceived now and having allergies?
Actually, there are, I mean, as I mentioned, to control the inflammation, the safer anti-inflammatory medications, like even in uh, Ayurveda, homeopathic and all, they are used. So it depends on the expertise into that field, it can be continued, but definitely it should be with the proper experts.
So, can you give us a take home message
Yeah, actually,
for
allergy should be taken very seriously. It is a progressive disease, not only to the woman, even to the next generation children also. So it should be managed with expert advice like allergist and clinical immunologist. Some specific allergy tests should be done. Some specific precautions can be taken indoor, outdoor, and with the simple, safe medications, it can have a very good quality of life, and it is very helpful for long-term purpose also. They can have a very good quality family life, basically. That way.
Right. So
Yes.
thank you, Dr. Vijay Virat,
Thank
for joining us today. Could you show us the certificate, please? I think there's some communication. Thank you. Thank you so
you.
much,
Thank you.
Dr. Vijay.
Thank you.
This is a small token of thanks from our side for you sparing your time, giving us so much knowledge, being with us, and telling our viewers and listeners so many things. Thank you, Doctor.
Thank
That
you.
will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.